Well, good morning and welcome to the Gold Room here on what is a please be seated, significantly historic occasion. I know there's been great anticipation to the formal rollout of what we've called the Healthy Utah program. And we welcome one and all here today, and particularly happy to have the media here. I've had the opportunity already this morning to meet with Speaker-elect Greg Hughes and talk to him about this and give him a little bit of a preview. I also have had the opportunity to speak to President Wayne Niederhauser of the Senate and talk to him about this rollout. We've followed their invitation to present to their legislative health task force, and that's really just concluding right now. We've tried not to overlap. They've changed the order upstairs a little bit, so it's delayed us a little. But we appreciate the legislature and their willingness to hear what we are proposing here and to consider it, and hopefully we'll come together on the solution here today called Healthy Utah. I want to thank Lieutenant Governor Spencer Cox and Dr. David Patton and his team in making the presentation to the Legislative Task Force upstairs, and the details of the presentation some of you have covered. But all the details will be in this booklet we have here called Healthy Utah, which we'll make available to those who want to have access to it. It'll also be put on our webpage so you can access it electronically. But it's about 25 pages of detail and specifics as far as how the Healthy Utah program will work and who's going to be covered and the costs and those kinds of associated things. I want to also, before I get into my brief remarks, acknowledge those who are here with me this morning in show of support of this effort. I appreciate them taking time out of their busy schedules. They are an eclectic group that represents a lot of different stakeholders throughout this great state of Utah that are here today showing support for this effort. I'll just recognize them in not any particular order, but let me just mention their names and they can wave their hand. Gail Miller from the Larry H. Miller Group of Companies, Bishop Gary E. Stevenson, the presiding bishop of the Church of Jesus Christ of Latter-day Saints, Bishop John C. Wester, Bishop of the Catholic Diocese of Salt Lake, Scott Anderson, President of Zion's Bank, Kim Gardner, Mitt Romney's best friend, a contractor extraordinaire, Dr. Vivian Lee, University of Utah Healthcare, Dr. Charles Sorensen, Intermountain Healthcare, Lane Beatty, President of the Salt Lake Chamber of Commerce, Paul Merrill, former President of the Sutherland Institute, Mark Bouchard, President of CBRE Real Estate, Pamela Atkinson, my advisor, the Mother Teresa of Utah, and an advocate for those in need. Spencer Eccles of the Eccles family is here with us, our former GOED director. We have David Entwistle, where's David, who's here with us. Rick Walge from Rocky Mountain Power. Adam Troop from the Utah Association of Counties. We have Greg Miller with the Larry H. Miller Group of Companies. Also Steve Miller and Brian Miller are here also. We have David and Paul Huntsman of the Utah Huntsman Cancer Institute. Clint Ensign with Sinclair, Terry Buckner, who's the chair of the Salt Lake Chamber of Commerce and the owner of the Buckner Company. We also have with us, I think somewhere here, Lieutenant Governor Spencer Cox, and the most important person in my life is the First Lady Jeanette over here with us also. So recognize my son Brad, who's with us too. I think it's important to understand as we have this discussion today, and this is really the beginning, this is not the end. We've had a lot of preliminary work to get us to this point today, but we need to recognize kind of the unique dilemma that we face, not only in Utah, but across the country when it comes to the Affordable Care Act and the unique challenges that puts on the states. It's no secret that I've not been a supporter of the Affordable Care Act. We were one of 24 states that sued on constitutional grounds, particularly the Commerce Clause, that it was not a constitutional mandate to the states. But the act did pass, challenged in court, and held by the Supreme Court with a twist that took place that said that rather than it be a mandate, the Medicaid expansion aspects of the Affordable Care Act are voluntary. They changed that by saying that there was not a penalty, but there was a tax, and so it was constitutional for Congress, in fact, to tax us for this act, even though we had the option of whether we wanted to spend the money under this act. And in Utah's case, we send about $680 million per year back under the Affordable Care Act to Washington, D.C. Again, I'm hopeful. I've talked to the president about this, as have many others, and on the Democratic side, there's a recognition that there needs to be, in fact, a fix to the Affordable Care Act, that it's not perfect, that it needs improvement. On the Republican side, you hear commonly, we need to repeal and replace. Repeal it and replace with something better. Both of those avenues, I think, are avenues that ought to be taken, and I hope that we, in fact, find better outcomes with the Affordable Care Act with Congress, that working with the president can get some improvement. That being said, the Affordable Care Act is the law of the land, and I have to deal as the governor of Utah with the realities that that is the law of the land, and our taxpayers are sending large amounts of money back to Washington, D.C. to spend as they see fit. It's under the Affordable Care Act, we have approximately 63,000 people, men and women and children, who are living below the federal poverty level that are not being treated fairly under this act. And so we have a responsibility, in fact, to see what we can do to solve that problem. By the way, these are individuals that are making less than $12,000 a year. Actual number is $11,670 a year, qualifies you to be below poverty. So the question is, who are those folks out there, and who qualifies? Single mothers, they are low-income adults, there are families that have children. We also find, uniquely so, that 2 out of 3 of them are employed. So 2/3, many working more than one job to try to make ends meet, but they're in low-paying jobs. The other third are typically classified into what we would call medically frail, but they're unable to work because of their medical conditions, health conditions, and makes it impossible for them to find or hold a job. And these are, of course, our neighbors, our friends, and our family members. So the challenge for us is to see what we can do. Utah is known for being a caring community. We do care about our neighbors. And we want to care for those who are less fortunate, those who are most vulnerable amongst us in society. And turning a blind eye and doing nothing is really not the Utah way. So we're going to find a way, and that's hence why we've come up with this Healthy Utah approach. And while we didn't create the problem or cause the dilemma that we're facing, I'm confident that as we come together, the governor's office, the legislature, the private sector, stakeholders throughout the state, that we will, with the Healthy Utah, move down the right path of solution. The Healthy Utah plan actually meets 4 criteria that I've outlined that I think are principles that should guide us as we face this challenge and try to solve the dilemma. One, the Healthy Utah plan does respect the taxpayer. The taxpayers are being billed for the Affordable Care Act. And as I mentioned, about $680 million. There's about $446 million of that we can draw back to the state of Utah and spend under the Healthy Utah plan, or leave it in Washington, D.C. We've chosen and believe that as opposed to just expanding Medicaid in a traditional form, that with the Healthy Utah approach, we can actually get better health care outcomes and help improve people's lives and spend those dollars much more effectively and more efficiently and respect the taxpayers who are putting up their hard-earned money in the form of taxation. Second, it also supports private markets. Rather than this just put it into a government program, a federal government program, we believe it's better and more efficient to the marketplace to have these dollars redirected into the private sector. So private health insurance, and people will have more choice, more options, and I believe actually get better health care through the private market system that we have already in place. 3, it promotes individual responsibility. I think, again, the culture of Utah is one of a can-do spirit, of pull yourself up by your bootstraps and help yourself, and then help your neighbor. And this is, again, allow people and require them to have co-pays, pay a partial premium, pay for emergency room services that they have not done so in the past. And again, they will have some skin in the game, as it were, in participating in the Healthy Utah plan. So they'll be motivated, in fact, to be careful about taking care of their own health. If you don't care about your health care, why should I? And so this will promote individual responsibility. It also connects them with an integrated job program. So again, the reason people are qualifying for government assistance is because, in fact, they are not making enough money. They are impoverished. They're the working poor. Sometimes they're just poor and not working. And with our approach here, we're going to help people. If you come and ask for assistance with your health care, we're going to help you not only with health care, but we're going to help you get a job if you're able-bodied and get you into a job. If you're able-bodied and underemployed, we'll help you get a better job so you can, again, get off of government assistance and be self-sufficient. And last but not least, this will maximize flexibility. I'm a big believer in the states, the concept of federalism, of finding innovation and creative ways of doing things. I rebel against the one-size-fits-all mentality that comes out of Washington, D.C. I don't think that's the best way to do things. And our Healthy Utah program has been a combination of much study over the last nearly 2 years. It also is a compilation of different states' efforts where we've taken some things we like and rejected things that we don't like and see out there. We've tried to find the best numbers so we have accuracy in what we're doing. And as we've studied this over the last 2 years, we've asked for another study to be done. And it was just completed 48 hours ago, which we have and have incorporated into our Healthy Utah program that we're passing out to the legislature today and to others who are interested, with as accurate and as updated of numbers as we can possibly have. We want to be able to define the program as best as we can. Again, in talking about the flexibility, that's one of the reasons why I've insisted this to be a pilot program. This has not been done before. We're breaking some new ground here. We have some experience in other parts of the state, but Utah is different than Oklahoma or Missouri or California or Idaho or New York. And so we need to have an opportunity to test the theory and see what happens. Hence, we're requiring the Department of Health to take and compile accurate data on those who we're helping, the recipients, the benefits they receive, their health care outcomes, also tracking what the federal government's responsibility is and will be, and making sure that they commit and fulfill their promises and keep their commitments that they are making to us. And last but not least, the ongoing cost to the taxpayers of Utah. What is going to be our short-term cost and what is going to be our long-term cost? The fiscal aspects of this are the things that are really causing people concern, wanting to make sure we're not buying something today that we cannot afford tomorrow. And again, that's what we're going to be working with the legislature. Let me just conclude my remarks here and say, again, where I started. This is the beginning. This is not the end. This is a beginning. We have a benchmark laid out here with Healthy Utah. I look forward to working with members of the legislature on them debating, discussing, and having appropriate dialogue amongst themselves with the governor's office, and particularly with the people of Utah who need to weigh in on this. There'll be pro and con, I'm sure, and we encourage people to weigh in. But I can promise you that I understand the responsibility as governor of this great state that we have to make sometimes some tough decisions. And I expect that every elected official in the legislature understands that too. This is not an easy issue to decide. It's not as black and white as some would like to make it. It is one that's fraught with some emotion. It is a desire to find the rational and reasonable approach and be responsible to not only the taxpayers but those who need some help and a helping hand. So I want the legislature to know that I'm looking forward to working with them. They can count on me of being a partner as we have this discussion. We can ask the tough questions, and we'll find the right answers in representing the people of Utah.